Hello again, everyone. My name is Andrew Velpe. I am the Marketing and Communication Manager for Fear Free, and I'll be your host and moderator for tonight's Fear Free Top 5 and 15 webinar. We are thrilled to have you join us, and we'd like to extend a warm welcome to all of you veterinary tech students attending today's presentation of the top 5 things about pain that you need to know with Dr. Mike Petty. Before we dive in, I do want to share a few quick housekeeping notes. So as I mentioned earlier, your microphone will remain muted throughout the presentation to reduce the background noise. If you do have any questions, we will have time for a Q&A at the end of this, so please feel free to type them in the chat as we're going through this presentation. If you want to throw it out there, I'll be watching them. We'll make sure that we give you some time during the Q&A session. A recording of this webinar will be made available to all attendees within 2 weeks and will be sent to the email addresses that you use to register. So keep your eyes open for that. So this webinar is part of our Top 5 and 15 series brought to you by Fear Free, where we aim to provide you with quick, actionable items and insights to help you better prepare for your future in veterinary care. Fear Free's mission is simple. It's to reduce fear, anxiety, and stress in pets by educating the people that care for them. If you're interested in learning more about our mission, you can certainly visit fearfree.com. And don't forget to follow us at social media at fearfreepets for any updates on future webinars. The Top 5 and 15 series is also brought to you in part by the Association of Veterinary Technical Educators and the National Association of Veterinary Technicians in America. With all of that out of the way, it gives me great pleasure to introduce you to Dr. Mike Petty, who's with us today. Dr. Petty is a globally recognized expert in veterinary pain management. He is currently a member of the World Small Animal the member of the World Small Animal Association Global Pain Council, and a past president of the International Veterinary Academy of Pain Management. With a wealth of experience, Dr. Petty has taught primary care veterinarians around the world about anesthesia, analgesia, and chronic pain management. He is also the author of the book, Dr. Petty's Pain Relief for Dogs, which was published in 2016. Dr. Petty's insights will undoubtedly provide you with valuable knowledge that can enhance the care that you provide to your future patients. Now, without further ado, I'll hand it over to Dr. Petty and begin tonight's presentation. So Dr. Petty, feel free to take it away.
Thank you so much. Okay, a little bit about me. I graduated from veterinary school 40 years ago, so I've been doing this for a long time. I live on a horse farm with no horses anymore. I've gotten too old for it, but with 3 Portuguese water dogs that keep me absolutely busy or crazy depending on how they're acting. So I really love lecturing to veterinary nurses or LVTs, whatever you call yourself. I think they are the most important part of a team in the veterinary setting. And I'll talk a little bit about that as we go along. So next slide. So I changed the quote from no man to no person is an island entire of itself. And this is a quote from the poet John Donne. And I truly believe that we cannot do our job in isolation. We need the help of other people. And I'm going to demonstrate this a little bit in the next slide. So you can see a puzzle there on the right. And, we have veterinarian, receptionist, vet tech or nurse, pet owner, and animal. And, the veterinarians, we all think we're the most important member of the team. And, as your job as a nurse or a technician, you need to let them think that that's so. But, the reality is without input from you, I cannot do from you, the lay staff, animal caregiver, I can't do a job. I can't do it. I'm going to miss diagnoses. I'm going to miss treatments. And treatments will not get done without your help and without the understanding of all of this. So, the veterinarian ends up being an important player because in the end, they have to make the decision, but it is not a well thought out or informed decision without help from everyone. And, I'll talk a little bit about the technician in a second, but even starting with the receptionist has to be really pain aware. We've had examples in my own clinic where a client will call up. We do general practice in my clinic, but we do a lot of pain medicine too. So in general practice, a person will call up and they'll say, I need this vaccination, and can I make an appointment next Tuesday? And my receptionist will say, sure. How about 2 o'clock in the afternoon? And they say, no, I can't do it then. It has to be after 4 when my husband comes home, because my dog can't jump into the car by itself anymore. If that receptionist was not trained to be able, not only trained, but enabled to be able to say something to the rest of the staff, that vital piece of information could be gone, and an opportunity to help a dog in pain could be missed. As a vet technician, it's very important that you have the power and control to get a good history and to talk to the owners and to administer pain metrics. And we're going to demonstrate some different pain metrics a little bit later on. And then obviously we have to talk to the pet owner. And as as the handler of the animals, we have to have a cooperative animal. So we have to have a really nice, calm environment for this animal to be in, and find things that we can do. And of course, this is where Fear Free comes in. All right, next slide. So there was a movie from a film called Gaslight back in 1944. And it was a movie about this woman who was being driven crazy because they were in the house and they had natural gas lighting, and the lights would get dim and they get bright and dim, and she'd say, what's going on? Do you see that? And the other person was like, what are you talking about? There's nothing going on. And it was trying to drive her nuts. So it's not our intention to drive our clients nuts, but we can if we don't listen to them. And we really have to listen to everything that they have to say. Next slide. Yeah, there we go. So here's the problem. And you have to keep your veterinarian on track, because the longer that veterinarian practices, the more likely they are to try to make the diagnosis fit their preconceived notion of what's going on. And nurses can fall prey to the same issue. As you get used to things, it's like, oh, I've seen this before, based on 1 or 2 signs and not looking at the whole picture. So as a student or as a new graduate, an animal will come in with, and I'm going to pick a non-pain issue, but come in with anemia. And, as a new graduate, you think, wow, there's something like 100 different differentials for anemia, and all of them are possible. Well, no, they really aren't. A good history is going to knock out 3/4 of those things. But the longer you practice, and especially for the veterinarians, the longer that they practice, they start to get tunnel vision. They're like, I know what that is. And then they ignore the other signs that don't support their theory and enhance the signs that do support their theory. So what's the number one way to lose a client's trust? Gaslighting them. They're going to say, they don't listen to me. They say something, and it's like, yeah, okay. And then they go on to the person, the professional they're talking to acts like they never even heard it. Or maybe even worse, they don't believe Lee. Yeah, okay, but that's probably not it, and then they move on. So when those two things happen, then the client is asking, why should I follow their treatment recommendations? I don't think their diagnosis is right, and they don't really care what I have to say. Since you are the person that's taken the history, listen and write down every concern the client has. Don't be afraid to nudge the doctor if they are ignoring one of the points. And a good doctor will take into consideration your written history. And don't be afraid to question them. Why did you think that part wasn't important? Obviously, sometimes, depending on the veterinarian, some of them are, prima donnas, and you've got to be careful about how you say it, but stroke their ego and get them to consider everything that you see that they don't. Next slide. Okay, use pain scales, preferably validated. Next slide. So I want everyone to get their smartphones out and take a picture or use their computer and take a screenshot of this, just so they have an idea of what all this is. So there are two different kinds of pain scales, both acute and chronic, and you probably already know this. They can't be interchanged, but I'll tell you about my favorite ones. And I really like grimace scales because, the second you try to interact with an animal, they change their demeanor and you may not really see how much they are or are not in pain. They go into this don't eat me mode, and they act as happy and healthy as they possibly can while you're trying to look at them. If you can see them from a distance, that's great. Fortunately, we do have a feline grimace scale. Unfortunately, we don't have one for dogs. They're out there for a lot of other species. They have them for horses, they have them for rats, for mice, for ferrets, for rabbits, but none for dogs. No one's come up with one yet. So instead, I really like this Glasgow Composite Measure Pain Scale, the short form. It's pretty easy to use, and you can find this online. When it comes to chronic pain scales with dogs, there's a scale called the Canine Brief Pain Inventory. This is used often in a lot of studies. Like I was in a study where we helped both Librela get approved and Galliprant as well, and they both use the CBPI. I like that there's 3 sections to it, and there's the middle section called the pain interference score. And it's just maybe 8 questions, and it's really easy. It takes the clients only a few minutes to do. There's also the Liverpool Osteoarthritis in Dogs scale. When it comes to cats, there's these 2 other ones. The first one's out of North Carolina. The second one's out of Montreal. So investigate these, but they're no good unless everyone feels comfortable with them and everyone can use them. And, have a team huddle at work and have everyone look at them and vote for everyone's favorite. Next slide. Andrew, next slide, please. All right. I'm not sure what happened to Andrew. Oh, there we go. All right. I look at you guys as the pain detective. So next slide. As the pain detective, you have some things that are really going for you. You have way more intimate interactions with the patients, and this allows you to observe and record behaviors related to pain. The veterinarians often, at least in my practice, there's, I always have 3 technicians working for me and, to my 1. So it allows me to give them the time to be in back and to spend the time with the animals in addition to assisting me in the rooms. A lot of caregivers will have a way more honest discussion with you compared to the doctor. They're less intimidated, and they're more likely to talk about concerns of cost, time to treat. Maybe they've got stuff going on at home that really interferes with their ability to treat the animal. And you can ask them questions like that. And your education has a better emphasis on caretaking compared to the DVM. So you are in a unique position to be the pain detective. Next slide. Pain is inexorably linked to fear, anxiety, and stress. And this is the last thing I want to talk about. Next slide. Okay, so there was one study done out of the UK, and it showed that anywhere between 60 and 80% of all behavioral issues have their foundation in chronic pain. So this is like really important when we start thinking about fear, anxiety, and stress. Is the problem these animals are exhibiting in the exam room? Is it a pain problem, or is it a behavioral problem? Chances are the behavioral problem is secondary to pain. And when we look at the diagram of the brain here, they've got the emotion center and the pain center. They are like buddies right next to each other. So it's not a surprise that stimulation of one causes stimulation of the other. And we'll hear this where we treat an animal for pain. whether it's a dog or a cat. And, the clients will sometimes say, well, you know what? He's not limping anymore. But the other thing is he's allowing the other animals to approach him. And that was an issue a few, prior to the treatment. So there really is not only research evidence, but real world evidence that this is the case. So this is my last slide. We have a closing slide here, and we're going to open this up to any questions.
Excellent. Well, first and foremost, thank you, Dr. Petty, and apologies. Apparently, the rain has something to do with my internet being flaky tonight, so I do apologize for that.
That's okay.
But we did want to give everyone just a few minutes here to ask Dr. Petty for any questions.
So send them in if you've got any questions, and don't be shy. If you have any
questions that you would like to ask, this is your chance to ask one of them. I'll start. We talked a little bit last night about how fear, anxiety, and stress pays into the pain management element of it. And, one of the things I asked last night was, what if you have a pet who has a fear, anxiety, and stress level of maybe a 3 or a 4, but he's also showing a lot of signs of pain? What do you treat first, the fear, anxiety, and stress component of it or the pain component of it?
Yeah. Well, I mean, and I'm assuming it's not like really acute excruciating pain. And, kind of like what I said to the veterinary students last night, unless there's no pain treatment that's so important that it can't be delayed unless it's, the animal's on fire. You really should try to deal with the stress and fear part first, because it's just going to really grease the skids for the entire team to help handle this animal and to not just confuse the issue of why that animal is acting the way it is. And, we oftentimes will say to a client, we're going to send home some trazodone and we'll make an appointment for this afternoon and we'll see you back. Or, if it's totally unhandleable, then we'll talk about maybe an injectable at that point where we can do a thorough exam.
For sure. And I know gabapentin is often used as well. So certainly lots of options out there. Definitely.
Right. Gabapentin. And there's also the new product out by Zoetis called Bonquat, which is a pregabalin, and it's approved for anxiety in cats.
Absolutely. And we often say that, the trip to the veterinary visit even starts before you get to the veterinary. It starts at home for sure. So these are some great tips. Another thing, and folks, we've got a few more minutes, so please feel free. I'm keeping my eyes on the chat, but I'll ask you one more and see if anyone else has the questions that they're thinking of. You mentioned that the technicians are often the ones, or the nurses are often the ones asking the questions and being the detectives. And I mentioned to you as we were warming up here that slide really spoke to me. Is there questions that you can think of out of the ordinary that, technicians might often miss or something that, can give them a little bit of an extra advantage as they go into their courses and as they start to practice?
So one of the things, one of the magic questions you can ask someone is if they're kind of waffling, you're going to hear things like, oh, my dog's getting old, my dog's getting lazy. And, this is their perception. And maybe they think that's true, or maybe they don't want to believe that their animal is actually suffering. So, sometimes a different approach is to say, never ask them if their dog's in pain, just ask them how they're behaving, but ask them, what does your dog do now that's different from 3 or 4 years ago? And to try to get a perspective on there.
Excellent. Thank you for that. Well, we've got some brave souls asking some questions. We've got 3 coming in, so I'll start at the top. India said, should there be a maximum number of helpers for an animal that is fearful, but also not easy to restrain?
Yeah, if you're using more than 2 people, there's something wrong. You have to stop and do something. And when I say 2 people, sometimes it's a matter of, and there's all these great fear-free techniques, treats and so forth. But sometimes you need to keep an animal from backing up when it's on the floor. And so there should be one person with restraint and maybe one person to kind of corral a dog or something from backing up, or a cat from backing up. Anything more than that, you've got to put on the brakes, and you've got to say, okay, we need some kind of change in our approach. We need a chemical intervention, whatever it might call for.
Absolutely. And in some cases, those non-slip mats help too, definitely, for sure.
Right.
Kimberly asks a great question. She says, how do you balance the treatment of pain with side effects that may change pets' personality in a negative way? For example, making them lethargic.
Yeah. So, you have to adjust the pain medications. And, one of the problems is that I teach the veterinarians is you have to anticipate pain. And that's really your job, to be on the lookout so that you are not over medicating and making the animal groggy. Because if the animal gets too much wind up, then it is an issue trying to get them back to a baseline. So really, constant observation is the best way to prevent that from happening.
Absolutely. Thank you for that. Jose asks, how would you personally handle a pain-induced aggression?
So it depends on the animal, depends on, what the species. We will sometimes get dysphoric dogs that become very hard to handle. And, I don't want to reverse them. But, so we can do things like, give an injection of butorphanol, which is less likely to cause dysphoria. If the animal is heart healthy, I like to give microdoses of dexmedetomidine. And, don't quote me on this, but I think it's like about 5 micrograms per kilogram in an IV push. And oftentimes that just takes the wind out of their sails. It lowers their pain threshold and lowers their anxiety threshold.
Great answer. Thank you so much for that. I love this question from Tori, and it goes back to, the veterinary technicians and nurses being the detective and being that advocate for the pet, especially when you're typecasting or getting into that routine of instant diagnosing. Tori asks, in your experience, how have you encouraged new veterinary technicians to speak up about a patient's condition to a veterinarian?
Yeah. So this is a difficult thing because in many practice cultures, everything is top down, right? And a good veterinarian really needs to be able to listen to everyone. I'm kind of hoping the new generation coming out understands the importance of using teamwork, but I know that not always. For example, I was talking to a colleague in Japan. I was in Tokyo talking to them, and I said, in the United States, it's very hard for a technician to tell a veterinarian that maybe they're going down the wrong path or they need to consider this or that. And I said, I understand it might be even more hard in Japan. And he looked at me and said, no, not at all. It's impossible. So, depending on the culture, depending on the person, it's an uphill battle. I've given co-lectures with my office manager and receptionist at VMX, talking about how to overcome this stuff. But, unfortunately, a lot of the people that want to hear this already, it's like preaching to the choir. They already know. But I do, we can give some techniques. There is a book called The Checklist Manifesto, and you can buy it on Amazon. It's by an author named Gupta, last name, and he talks exactly about how the airline industry developed this bottom up and top down culture and how it applies to human medicine. And I think we can adopt a lot of that into veterinary medicine as well. So if you have a problem with a veterinarian, buy him the Checklist Manifesto and just leave it on his desk anonymously.
These are pro tips that'll help you all in your career. And I've put that name in the chat as well. Yeah. It looks like our last one from Kevon said, actually, we got one more after that. So we got two more, and then we're going to wrap it up for here. But Kevon asks, we were talking about pain management. Would you use trazodone for cats? I saw one vet recommending it or sedation when a cat was having anxiety in the room.
Yes, trazodone does work in cats. It's not my favorite go-to. I like gabapentin. I think it's more consistent. And if it's a cat that just is out of control, even with medications, then I'm always reaching for usually dexmedetomidine as an injection.
Excellent. Thank you for that. And the last one for the night, and I want to say thank you to all of you, first of all, for your questions. This group is definitely really engaging, especially compared to last night. So give yourself a little pat on the back for that. Julie asks, I brought my cat to the vet today with 200 milligrams of gabapentin on board, and she was screaming when they were trying to get blood. She was having no part of it. This was our second attempt, hence the GABA. What could we do differently for her or to her to make it possible for the techs or doctor to draw blood? And I'll let you go first because I also have a good answer too.
Okay, great. And I'm curious to hear yours. And before I forget, I do want to say, and this is always my experience, the techs always have the best questions. Last night we had to it was getting blood from a turnip trying to get some questions out of the veterinary students. So thank you so much.
Thank you.
There's not a great answer for that because, I would have to see the situation and everything. With fear-free techniques, you need to let this cat settle in the room. You got to have people not walking in and out of the room. You have to have the cat not in back where there's a bunch of distractions. Mm-hmm. If there's dogs barking and so forth, maybe you need to schedule this cat last appointment of the day when there's no one there. So there's a lot of things that I can't really address without knowing the exact situation. And in the end, we do have some cats, no matter how hard we try, we cannot do it without some kind of sedation. Butorphanol is kind of good because it does have a sedative effect. Again, dexmedetomidine is one of my favorite things to do because it's quick and it is reversible, and you can just send the patient's or the client's cat, or in this case your cat, home within minutes of reversing it.
Absolutely. And Dr. Petty, you kind of stole my thunder. Definitely. That's where fear-free comes into play. My answer was going to be, Julie, if you are going to a fear-free practice, that's great. Certainly work with them, continue to talk to them about the steps that you can take with your cat before the visit. But if you haven't had the chance yet, speaking from personal experience, and cheap sales plug for sure, but you can use our fear-free member directory on our website at fearfreepets.com to find a fear-free certified veterinarian or a fear-free certified veterinary practice in your neighborhood, and just work with them. We have a cat who is very stressed herself in our clinic. We also have 2 rabbits that don't like to travel too well, and they've had to go to a couple different vets before we found one that was fear-free certified. And speaking just from the heart, it does make a difference. So certainly if that's an option, Julie, definitely Kitty Magic is certainly one thing that some practices practice, but from me to you as a pet parent to another, certainly try to get into a fear-free certified veterinarian or a fear-free certified practice for sure. And yes, I'm saying that wearing the branded shirt, but I'm also speaking as a pet parent for sure. So right. I hope that helps. And well, folks, that is going to do it for tonight's webinar. A big thank you to Dr. Petty for his time and insights today. So thank you, Dr. Petty. It's been 2 great nights of conversation with you. On behalf of Fear-Free and our friends at the AVTE and NAVTA, we also want to extend our gratitude to all of you for attending tonight's Top 5 in 15 webinar. We definitely hope you found it helpful. Maybe it will give you an edge in your next exam or as you start to head into practice. And we encourage you to apply these techniques in your future practice to help reduce fear, anxiety, and stress in your patients. As a reminder, if you tuned in halfway through, don't worry. A copy of this recording will be available and sent to your email within the next 2 weeks, so be sure to keep an eye out for that. And you can follow us on social media at Fear-Free Pets for more educational content and updates. We're excited to be continuing the series on. We will be doing it monthly, and the next Top 5 in 15 series will be on November 13th. And this one's going to be an amazing one, just like Dr. Petty's. It's going to be focusing on the top 5 pitfalls of the emergency room, and that's going to be brought to you with Dr. Tony Johnson. So if you're looking to register, you can do that at fearfreepets.com/5, the word in 15. So fearfreepets.com/5 in 15. We hope you have a great evening. Let's give one more big 5 to Dr. Petty, and we'll see you guys again soon, I'm sure. For all of us at Fear-Free and for Dr. Petty, thank you.